Good day. I am a physician. Calcium and vitamin D supplements can cause serious harm at the wrong dose. Your orthopedist told you to start calcium immediately, and it seemed like the most logical advice possible. But your cardiologist would tell you something terrifyingly different about those same massive daily calcium supplements you take. Those pills may actually be accelerating the calcification of your coronary arteries every single morning you take them. And that high-dose vitamin D you take alongside them? A major clinical trial proved it protects nothing. This video is for educational purposes only and does not replace professional medical advice from your doctor. But we were given a dangerously incomplete half-truth that has caused measurable cardiovascular harm to millions of people. Pouring calcium into your bloodstream does not automatically mean your bones will absorb and use it effectively. Without a specific biological traffic cop to direct it, supplemental calcium deposits violently onto arterial walls instead. It turns flexible, life-sustaining arteries into brittle calcified pipes that cannot adapt to changing circulatory demands at all. Today, we resolve the conflict between what your bones need and what your heart is able to tolerate. We reveal the one critical missing vitamin that forces calcium out of your blood and into your skeleton. Number 6. The calcium paradox. High-dose calcium pills increase your relative heart attack risk by up to 30%. Taking a high-dose calcium pill creates an unnatural rapid spike in blood calcium. Your skeleton cannot absorb fast enough. Because the excess calcium has nowhere else to go, it begins depositing in the soft lining of arteries. This active arterial calcification directly and measurably accelerates atherosclerosis inside the very vessels that keep your heart alive. A staggering meta-analysis in the British Medical Journal analyzed thousands of patients to document this catastrophic phenomenon clearly. The study concluded that calcium supplements without proper biological cofactors increase your relative heart attack risk by 30%. 30% is not a marginal statistical noise. It is a clinically significant and completely avoidable cardiovascular threat. You are sacrificing cardiovascular health in a desperate attempt to protect hips that may not even need it. The solution is not to stop protecting your bones. It is to take calcium with the correct cofactors. Never take a calcium supplement again without understanding what you are doing to your arteries in the process. Number 5. Dietary calcium is safe. Food-sourced calcium never creates the arterial spikes that supplemental pills consistently produce. If calcium pills are dangerous for the heart, the answer lies in understanding the pharmacokinetics of natural food. Calcium consumed from dairy, leafy greens, fortified plant milks, and fish is absorbed gradually over several digestive hours. This natural slow-release mechanism never creates the massive, dangerous blood calcium spikes that an artificial pill produces instantly. Epidemiological studies consistently show zero increase in cardiovascular events from people who get calcium entirely through their diet. Food must always be your first-line bone protection therapy before any supplemental intervention is ever considered or introduced. A glass of milk, Greek yogurt, and a portion of broccoli covers a significant daily requirement. Supplemental pills should only be introduced under strict medical supervision when careful dietary assessment proves food alone insufficient. Calculate your actual daily dietary calcium intake honestly before automatically reaching for any supplement on the pharmacy shelf. Most older adults consuming a moderately varied diet are already meeting half to two-thirds of their daily requirement. Number 4. Vitamin D does not protect the heart. The Vital trial ended the vitamin D cardioprotection hypothesis definitively. For years, observational studies suggested that high vitamin D levels correlated with fewer heart attacks in studied populations. This correlation drove millions of people to aggressively supplement vitamin D purely for cardiovascular protection and nothing else. But observational studies cannot prove causation, and scientists knew that a true randomized controlled trial was absolutely necessary. The VITAL trial was launched as one of the largest and most rigorous cardiovascular prevention studies ever conducted. Researchers gave over 25,000 adults high-dose vitamin D, or an identical placebo, and tracked them for years. The results were definitive and sobering, producing exactly 0 reduction in heart attacks among the supplemented group. The Vitalite D group also showed 0 reduction in strokes and 0 reduction in overall cardiovascular mortality rates. Vitamin D remains absolutely crucial for bone metabolism, and immune function and deficiency must still be corrected promptly. But taking extra vitamin D, beyond correcting a proven deficiency, will not protect your heart under any circumstance. If you find this science-based breakdown helpful, please click subscribe and tap the notification bell right now. It only takes absolutely 1 second, but ensures you never miss the next video in this series. Number 3. Vitamin K2. Most doctors still do not discuss the one molecule that safely directs calcium to bone. Vitamin K2 is the essential biological director of calcium distribution throughout the entire human body every single day. When you absorb calcium into your bloodstream, vitamin K2 activates the specific proteins responsible for directing it into bone. Even more critically, K2 actively inhibits the proteins that allow calcium to deposit inside your arterial walls. It literally directs biological traffic, sending calcium into the skeleton, and simultaneously keeping it completely out of arteries. Without adequate K2, aggressive calcium supplementation does not rebuild bone effectively. It is simply feeding your cardiovascular system poison. This is not a theoretical concern. It is documented clinical pharmacology backed by multiple controlled studies across populations. The best natural food sources of K2 include natto, hard-aged cheeses, and egg yolks from pasture, raised hens. Most preventive cardiologists now recommend the MK-7 specific form of K2 at 100 to 200 micrograms daily. If you take calcium supplements without K2, you are running the engine without oil and calling it maintenance. We know calcium pills attack arteries without K2, and vitamin D cannot defend the heart from cardiovascular disease. But how much calcium do you actually need to supplement? And how do you take it without causing damage? Number 2. The 500 milligram rule. Your body cannot absorb more than 500 milligrams of calcium at one time. If your doctor confirms you need supplemental calcium because diet alone is genuinely insufficient, follow this one rule. Your body cannot physiologically absorb more than 500 milligrams of calcium at any single digestive sitting. Taking a massive 1,000 milligram pill in the morning guarantees an arterial spike and wastes half the dose. Calculate your actual daily dietary calcium intake first before deciding how much supplemental calcium your body requires to function. A single glass of milk provides approximately 300 milligrams, and a serving of yogurt provides similar amounts. Only supplement the specific calculated deficit, never exceeding 500 milligrams per dose, taken at any one time. Always take your calcium supplement alongside a meal to slow absorption and minimize cardiovascular risk from blood spikes. Split a higher required dose across 2 separate meals rather than taking it all in one sitting. Less calcium delivered correctly is infinitely more effective and safer than more calcium delivered recklessly without biological context. Number 1. DEXA scanning first. Do not take supplements out of fear without knowing your actual bone density. Do not guess the state of your skeleton, and do not take supplements out of unverified generalized fear. The only way to know if you actually need any intervention is through a DEXA bone density scan. A DEXA scan takes 10 minutes, is painless, and delivers a precise quantifiable snapshot of your bone health. If your resulting T-score is normal, or shows only mild osteopenia, aggressive supplementation is often entirely unnecessary and harmful. Schedule a baseline DXA scan at age 65, or earlier if you have specific documented risk factors. Risk factors include chronic steroid use, early menopause, a family history of fractures, or extremely low body weight. Your doctor may not offer this scan proactively, so you must request it by name at your next appointment. One objective number from that scan eliminates all the guessing that currently drives most supplement decisions in older adults. Objective data must always precede supplementation decisions, because treating a problem you do not have is still causing harm. Your heart and your bones do not have to be biological adversaries competing against each other for limited calcium. If you currently take large doses of calcium and vitamin D without K2, you are feeding your arteries instead. Evaluate your real dietary calcium intake honestly before assuming any supplementation is necessary for your individual situation today. Ask your doctor for a DEXA scan to get objective baseline data before spending money on any supplement protocol. Always add vitamin K2 in the MK7 form to any calcium supplementation protocol without any exception whatsoever. Your bones require structural strength and your arteries require biological flexibility, and both demands can be met simultaneously. Protect them both with genuinely informed decisions, because uninformed supplementation is still a measurable form of harm. Subscribe, tap like, drop a comment below, and share this video with someone you love.